Welcome to Be Confident Coaching Center. If you wish to join the online or offline classes for OET, you can contact me at the given number displayed on the screen. Today I am going to do the OET letter of Mr. George Gale. So let's read the question. Read the case notes and complete the writing task which follows. Assume that today's date is 15 May 2021. You are a nurse at Old Town Hospital responsible for the care of an elderly patient who was admitted after a fall. He is now ready to be discharged. So after reading the question, you will have to move to the writing task. The question is, using the information given in the case notes, write a letter of discharge to Miss Gold, the head nurse at Primrose Nursing Home. In your letter, briefly outline Mr. Gale's history as well as your concerns and recommendations. Address the letter to Miss Jane Gold, head nurse, Primrose Nursing Home, 3 Blackwood Street, Old Town. So after reading the writing task, let's move to the question. The name of the patient is George Gale. His date of birth is given, address is given. His social background shows that he is retired retail manager. Actually, that's not important. Widower, son, works abroad, independent, cooks daily, walks to shops, social drinkers, smoker, 10 cigarettes per day. So let's see if it's a known case or unknown case. If in the letter it's given that the address of the patient as well as the nursing home is same, then it's a known case. Otherwise, it's unknown case. Now moves to the medical history. In 2003, he had osteoarthritis, 2009 hypertension, and all the disease conditions have been stated. The medications have been stated. Presenting complaint that he is disoriented and fever following a fall. So he had a fall and after that he had disorientation and fever. He was admitted in the hospital on 10 May 2021. So let's see what was the incident. Patient reports fall on 9 May while brushing teeth, felt weak, legs gave way, fell backward and head strike, approximately 5 hours lying on the floor. Neighbors heard call for help around 3:10 May, called ambulance. 2 weeks before fall, single episode of vomiting, palpitation and dysuria. Objective confusion, disorientation, temperature, blood pressure was elevated as well as the respiratory rate was also elevated. Urinary analysis stated that he had urinary tract infection, probably due to cause of fall. Okay, so due to the urinary tract infection, he had a fall. There's a question mark given that shows that there is a probability of fall due to urinary tract infection. Treatment record is given that he was given antibiotics intravenously, and observations shows that he had nil dizziness, that means no dizziness or palpitation. His temperature is being given, everything is normal, back to normal after giving the antibiotics. Now he's ready for discharge to nursing home for temporary care. That's very important. It's a respite care. Concerned patient lives alone, no home help. So he doesn't have any home help. That means he requires assistance to do activities of daily living. Keen to return to own home. He wants to return home as early as possible. Significantly lowered mobility. 30 minutes per day of physical activity to be encouraged. So he has to be encouraged, that you can write in the discharge plan. Still episodes of confusion, assessment for independent living was recommended. Now the plan shows that you have tried to head nurse at nursing home regarding further care required. Okay, let's move to the answer. 15 May 2021, the date is being mentioned on the top. Thereafter, Miss Jane Gold, Head nurse, Primrose Nursing Home, 3 Blackwood Street. Dear Miss Gold, the reference is Mr. George Gale. He's aged 85. So in the first paragraph, you need to write the purpose as well as the disease condition. This letter refers to Mr. George Gale, who requires respite care and assistance at your facility. So it's a temporary care. He's recovering from urinary tract infection and he is being discharged today. First body paragraph. On 10 May 2021, Mr. Gale appeared disoriented and febrile when he was brought to a hospital following a fall, probably due to urinary tract infection. During hospitalization, he reported that he had a single episode of vomiting, palpitation and dysuria 2 weeks ago. On examination, his vitals were uneventful except elevated blood pressure at 155/80 and respiratory rate at 26 per minute, respectively. His urine analysis confirmed the diagnosis. His condition was managed with intravenous amoxicillin 750 mg 8 hourly. Currently, his condition has improved. However, he still has confusion and impaired ambulation. I believe you have understood the letter till here. Mr. Gale has been leading a solitary life without any assistance. He is incompetent to perform activities of his daily living independently, but prefers to return home as early as possible. His medical history reveals that he has had osteoarthritis and hypertension since 2003 and 2009 respectively, along with non-specific colitis which are being treated with medications. I did not specify the medication here because in the next sentence I have mentioned the clinical report and prescription have been enclosed. So you need not write the name of each medication because you will have to write in 180 words, otherwise you will cross the limit. Now the final paragraph. Let's move to the discharge plan. It would be appreciated if you could assist him in his activities of daily living till he becomes independent. Please note, he needs encouragement to do exercise at least 30 minutes a day to improve his mobility. Kindly assess him for episodes of confusion. He has constant confusion, so assessment is required for that. Please do not hesitate to contact me if you have any queries. Yours sincerely, registered nurse. I hope you have understood the letter. If you liked the video, please do not forget to like, share and subscribe. Thank you for now.